Well, thank you very much. I'm delighted to be able to join this distinguished group here at the American Public Health Association. Earlier this year, in January, when celebrating the 50th anniversary of the first ever Surgeon General's report, the one on smoking and health, we had a reunion here in New Orleans, and it was in conjunction with the fact that Surgeon General Regina Benjamin had been appointed to an endowed professorship at Xavier University in public health. And so we were delighted to be able to meet at Xavier to celebrate the 50th anniversary, but also to celebrate this very important appointment. Now, there's something very familiar about this setting. You see, back in 1997, after serving as director of the CDC for about 5 years, President Clinton nominated me to serve as the 16th U.S. Surgeon General and Assistant Secretary for Health. But this was in August of 1997. But in November, I believe, in Indianapolis, the American Public Health Association met, and I was invited to come there to speak. And the night before the opening session, I received a call telling me that my nomination had been put on hold by Senator Ashcroft. And that was the beginning of a long struggle, but there was another message that came that night, and it was that President Clinton, who was supposed to give the keynote address at the opening session the next day, was not going to be able to make it, and he wanted me to give the keynote address. So it brings back memories to be here. No, the American Public Health Association has been very important in my career. I was appointed Surgeon General in February of 1998, but I did want to say one thing about the struggle to get through the hold on my nomination in the Senate, because some of the major players in that were not members of President Clinton's party. They were people like Senator Orrin Hatch and especially Senator Bill Frist from Tennessee. And Senator Frist supported me because he knew me from the time that I had served as president of Meharry, and Senator Hatch knew about a lot of the programs that I had pushed at the CDC. Some of the same programs that Senator Ashcroft was using against me. But what was so great about that was that people of different parties came together for what they believed. And they didn't have a standoff based on whether they were Republican or Democrat, but they came together and supported or opposed me based on what they believe. And it was great when my nomination was finally approved. My agenda as Surgeon General was sort of shaped in part by my experience as director of the Centers for Disease Control and Prevention. During that period of time, obviously we were very concerned about smoking and health. And of course, as you know, the CDC does most of the research for reports dealing with smoking and health through the Office of Smoking and Health. So when I became Surgeon General, I released 3 reports on smoking and health over a period of time, one dealing with minorities and smoking, one dealing with women and smoking, and an agenda for reducing tobacco use. A report that was later used by the World Health Organization in its treaty development dealing with smoking and health. So that area turned out to be very important, as you would expect, based on our work at the CDC before that period of time. Later, I was able to release the first ever Surgeon General's report on mental health. And actually, of all of the reports that I released, I think the feedback from that report stood out I received letters and telephone calls from people all over the country expressing the fact that they were so pleased that the Surgeon General was finally taking on the issue of mental health. I especially remember a letter that I received from a young man who related to me that when he was 8 years old, his mother had experienced suicide. And he was 8, and nobody would talk with him about what happened to his mother. So he went through life knowing that his mother committed suicide, but not being able to talk about it. And he explained to me that because of the report that we had released, he was going to call a meeting of his family the next week, and they were going to talk about his mother's suicide. So I received several letters like that. Another report that we were able to release later was the report on overweight and obesity, which we released in December of 2001. And it was a very interesting report in terms of the way we worked together to put that report out. It was very important. Now, when the election took place in 2000 and President Bush was elected, I had a year left on my term because of the delay in my confirmation. When I was confirmed and the Senate gave me 4 years, President Clinton only had 3 years left on his term. So when President Bush was elected, I went to him and I said, well, President Bush, you know, I know that I have a year left on my term, but I also know you want to appoint your own Surgeon General, so I just want you to know I'd be happy to step down. And he said, no, David, I want you to stay on and serve out your term. And I did. And I'm really happy that I did, because if I had not stayed that last year, I would never have released a report on overweight and obesity, the first report on that topic. I also would never have released a report on mental health, culture, race, and ethnicity. We had worked on these reports, but they never would have been released if I had not stayed that last year. And I never would have released a report on sexual health. Now I have to say that the report on sexual health was probably what convinced the Bush administration that they were ready for me to go. So it was interesting. It was the only report I released where the secretary did not show up at the press conference. When asked about the report by the press, President Bush's spokesperson said, well, you know, President Bush didn't appoint that Surgeon General anyway. But I mean, I think we laugh about it, but what the Surgeon General does for this country is irreplaceable. Our role, our responsibility is to communicate with the American people based on the best available public health science. Not religion, not personal opinions, not politics, the best available public health science. But it is a challenge, but I just hope that the role of the Surgeon General in this country will survive all of those challenges, because I think the American people need that particular role. Since leaving government, I have continued work with mental health, as many of you know, and have also continued work with overweight and obesity by starting the program Action for Healthy Kids. But the Satcher Health Leadership Institute has a mission of developing leaders in medicine and public health who are committed and prepared to working to reduce and ultimately eliminating disparities in health. As Assistant Secretary for Health, I had the responsibility for leading the development of Healthy People 2010, and it was in that report that we first announced the goal of eliminating disparities in health. And that goal was later, of course, followed by joining with the World Health Organization goal of global health equity. Those are very important goals, and I hope we, in fact, will stay the course until we have reached those goals. We have a saying at the Satcher Health Leadership Institute It is that in order to eliminate disparities in health, we need leaders. We need leaders, first and foremost, who care enough. But we also need leaders who know enough. We need leaders who have the courage to do enough. And we need leaders who will persevere until a job is done. We need the Surgeon General to continue. Thank you.